Elizabeth Stier-Storfferi XS 48690. Multiple sclerosis. Elizabeth Stier-Storfferi XS 48690. What is multiple sclerosis? Multiple sclerosis, also known as MS, involves an immune-mediated process in which an abnormal response of the body's immune system is directed against the central nervous system, which is made up of the brain, spinal cord and optic nerves. Within the SNES, the immune system attacks myelin and nerve fibers. Myelin is the fatty substance that surrounds and insulates the nerve fibers. The damaged myelin forms scar tissue that is known as sclerosis. This is how the disease gets its name. When any part of the myelin sheath or nerve fiber is damaged or destroyed, nerve impulses traveling to and from the brain and spinal cord are distorted. This results in a multitude of symptoms. Video can stop at 1:12 time. What causes this? The etiology, or the cause, of multiple sclerosis is still unknown. Therefore there is no cure for MS as of right now. Scientists believe that the interaction of several different factors may be involved in the cause of MS. There are ongoing studies in the areas of immunology, environment, genetics, infectious agents, immunologic factors. MS is generally believed to be an autoimmune disease. This means that the immune system, which normally protects us from disease and infection, reacts against normally occurring antigens as if they were foreign. Basically, this causes the body to attack itself by accident. It is believed that some aspect of myelin is the target of this attack, but the exact antigen remains unknown. Environmental factors. Geography. MS occurs more frequently in areas that are farther away from the equator. Smoking increases a person's risk of developing MS and is associated with more rapid progression of the disease. Vitamin D deficiency supports the functions of the immune system and may help protect against immune-mediated diseases like MS. Genetic factors. Multiple sclerosis is not hereditary. However, having a first-degree relative with MS significantly increases the risk of developing the disease. The ratio of women with multiple sclerosis compared to men is 2:1. Some researchers theorize that MS develops because a person is born with a genetic predisposition to react to some environmental agent, and when you are exposed to that agent, an immune-mediated response is triggered. Infectious factors. Multiple sclerosis is caused by damage to the myelin. Viruses are recognized as a cause of demyelination. Therefore, since initial exposure to numerous viruses occurred during childhood, it is possible that a virus or other infectious agent is a factor that could trigger MS. Viruses that are being studied right now as possible causes of MS include measles, human herpes virus 6, Epstein-Barr, chlamydia pneumonia. Symptoms of multiple sclerosis. Not all symptoms affect all MS patients. Every case of MS is different and no two people have the same complaints and no one develops all of the symptoms. Symptoms may be persistent or may die down from time to time. Most patients have episodes of attacks and remissions throughout the disease course. Symptoms may remit completely, leaving no residual damage, or partially leaving permanent impairment. Common symptoms of multiple sclerosis: fatigue, numbness, burning, or tingling sensations, pain, tremors, impaired balance and/or coordination, depression, muscle spasms, bladder issues, bowel issues, impaired vision, dizziness and vertigo, cognitive and emotional dysfunction, sexual difficulties, numbness, burning, or tingling sensations occurs in trunk and extremities. Tremors, shaking or trembling of a limb or occasionally the head. Bladder issues, increased frequency of urination, urgency, dribbling, hesitancy, and incontinence. Bowel issues, constipation, diarrhea and incontinence. Dysfunction occurs in almost 2/3 of patients during the disease course. Dizziness and vertigo, may feel off balance or lightheaded, or have the sensation that they or their surroundings are spinning. Vertigo. Cognitive and emotional dysfunction involves memory, reasoning, verbal fluency and speed of information processing. Emotional changes include euphoria, depression. Sexual difficulties. Problems include decreased sexual drive, impaired sensation, diminished orgasmic response, and loss of sexual interest. Less common symptoms of multiple sclerosis. Speech problems. Difficulty breathing. Difficulty swallowing. Seizures. Headaches. Hearing loss. Speech problems, slurring and loss of volume. Difficulty breathing occur in people whose chest muscles have been severely weakened by damage to the nerves that control those muscles. Swallowing problems result from damage to the nerves controlling the many small muscles in the mouth and throat. Progression of multiple sclerosis. Relapses and progression of disability are the two basic clinical phenomena of MS. Relapses are caused by acute inflammatory demyelination in the central nervous system. Progression is caused by chronic demyelination, gliosis, and axonal loss. Early in the disease, remission of symptoms is likely due to resolution of inflammation, channel redistribution, and the repair of myelin. Gliosis, a reactive change of glial cells in response to damage to the central nervous system. Glial cells are cells that maintain homeostasis, form myelin, and provide support and protection for neurons in the central nervous system and peripheral nervous system. Diagnosis of multiple sclerosis. Early diagnosis is important because there is growing evidence that early intervention is useful. There are no specific tests for MS. Instead, a diagnosis of multiple sclerosis often relies on ruling out other conditions that might produce similar signs and symptoms. Tests that can be used to help diagnose MS include evoked potential tests, blood tests, lumbar puncture, MRI. Blood tests perform blood work to help rule out conditions that have symptoms similar to MS, such as collagen vascular disease and other rheumatologic conditions, infections like Lyme disease or syphilis, endocrine abnormalities like thyroid disease, vitamin B12 deficiency, sarcoidosis, vasculitis. Lumbar puncture. A small sample of fluid is removed from your spinal canal for laboratory analysis. This sample can show abnormalities in antibodies that are associated with MS. Spinal tap can also help rule out infections and other conditions with symptoms similar to MS. MRI can reveal areas of lesions associated with MS on your brain and spinal cord. Evoked potential tests. Medications for multiple sclerosis. The goal of treatment for patients with multiple sclerosis is to prevent relapses and progressive worsening of the disease. There are two aspects of treatment for MS. Immunomodulatory therapy for the underlying immune disorder. Therapy to relieve or modify symptoms. Immunomodulatory therapy. Corticosteroids. Interferon beta. Glatiramer acetate. Azathioprine. Corticosteroids. They are the foundation of treatment for acute relapses of multiple sclerosis. They have immunomodulatory and anti-inflammatory effects that restore the blood-brain barrier, reduce edema, and may possibly improve axonal conduction. Corticosteroid therapy shortens the duration of the relapse and accelerates recovery. Interferon beta. Interferon beta is the treatment of choice for patients with relapsing remitting multiple sclerosis. Two forms of recombinant interferon beta, 1A and 1B. Glatiramer acetate. It is an immunochemical mimic of myelin basic protein, which is a putative autoantigen in multiple sclerosis. Azathioprine depresses both cell-mediated and humoral immunity and is proven to reduce the rate of relapse in multiple sclerosis. Management of multiple sclerosis. Therapy for symptoms. Tricyclic antidepressants and anticonvulsants. Oral, sustained-release alphampridine, Ampira. Supportive therapy provided by speech pathologists or occupational therapists. Serotonin reuptake inhibitors. Amantadine. Increase fluid and increase dietary fiber. Scheduled voiding, limiting fluid intake in the evening, using anticholinergic medications, eliminating diuretics. Tricyclic antidepressants and anticonvulsants help with pain tolerance. Oral, sustained-release alphampridine, also known as Ampira, has been shown to improve walking ability in patients with MS. It is the only medication approved by the FDA for this indication for MS patients. Supportive therapy provided by speech pathologists or occupational therapists is treatment for cognitive dysfunction, which includes memory, comprehension, problem-solving, and speech issues. Selective serotonin reuptake inhibitors are preferred for treating depressive symptoms. Amantadine is usually the first-line drug for treatment of fatigue in MS. Increase fluid intake to 8 to 10 cups daily and increase dietary fiber to 15 grams can help with the most common bowl issue of MS, which is constipation. Scheduled voiding, limiting fluid intake in the evening, using anticholinergic medications, e.g., oxybutynin, eliminating diuretics, e.g., caffeine, can help with the most common bladder issue of MS, which is failure to store. Multiple sclerosis and exercise. Current research indicates that MS patients can gain a wide variety of therapeutic and functional benefits from regular physical activity. Prescribed exercise does not increase the rate or severity of MS. Exercise is helpful in managing common symptoms of MS and promoting wellness. The primary benefits of regular exercise for people with MS include increased cardiorespiratory fitness, improved muscle strength and endurance, reduced systemic fatigue, improved mood, improved ability to perform tasks of daily living with increased vigor. Exercise also reduces the risk of comorbidities such as obesity, heart disease, diabetes and osteoporosis. Due to some symptoms of MS, fatigue, ambulatory issues, decreased balance, etc., it may be difficult to patients to perform some exercises. Case study, patient details, risk stratification, risk group, goals. Female, 30 years old, BMI of 20, works as a secretary, currently does not exercise regularly, does not smoke, systolic blood pressure 138 mm Hg, diastolic blood pressure 80 mm Hg, LDL cholesterol 126 mg DL, HDL cholesterol 42 mg DL, blood sugar level 90 mg DL. Risk stratification. She only has one risk factor, which is her sedentary lifestyle. Risk group. Low risk. Goals. Improve balance to help her in activities of daily living. Improve her cardiovascular endurance so she won't get tired out quite as easily when she is walking. Improve muscular strength to help her be able to pick up heavy objects more easily. Special considerations. She lives a sedentary lifestyle, so she is not used to exercising and is fatigued from her MS, so she will tire easily. She has trouble balancing because of her MS. Goals. Since she is an MS, her desire to have an exercise prescription is not to improve her athletic ability. She wants to be able to improve her quality of life and ease with activities of daily living. Exercise testing. The information gathered from an exercise test can be useful for establishing a safe and effective exercise prescription for low-risk individuals. Before the test. Pre-exercise medical history obtained. Preliminary physical examination performed by qualified health professional. Informed consent. The test. 6-minute cycle ergometer test to assess aerobic capabilities. Hand grip dynamometer grip test to assess muscular capabilities. Sit and reach test to assess flexibility. Flamingo balance test to assess balance. Cycle test because it doesn't involve balancing on a treadmill, which she might have difficulty with. Flamingo test because it is a safe test that won't put her at risk for injury, such as a balance beam test that she could easily fall off the balance beam. The exercise prescription. Cardiorespiratory endurance. Frequency 5 days per week. Intensity moderate, 5 to 6 on the 10-point exertion scale. Time 30 minutes each day. Type. Cycling on a stationary bike. Water walking in a pool. Walking. Muscular strength/endurance. Frequency 3 days per week. Intensity moderate, 5 to 6 on 10-point exertion scale. Time 15 repetitions, 3 sets. Type. Wall push-ups. Wall squats. Bridge. Modified plank. Overhead press with dumbbells. Calf raises. These exercises provide her with stability and safety, won't put her at high risk for falling or injuring herself. Range of motion frequency 2 days per week. Intensity stretch to the point of slight discomfort or feeling of tightness in muscle. Time sets of 20 seconds, 60 seconds total time per target muscle. Type. Hamstring stretch. Hip flexor stretch. Back scratch stretch. Arm cross stretch. Beginner level yoga, balance frequency 3 days per week. Intensity perform exercises that client is comfortable with and feels safe performing. Time 30 minutes per day. Type. Walking in heel-to-toe pattern forward and backward. Leg balance with eyes closed. Leg swings. One-legged clock with arms. To conclude, at least 400,000 people in the United States suffer from multiple sclerosis. It's a terrible disease that no one should ever have to go through. Although MS is a very life-altering disease, there are still ways that you can improve your life after you are diagnosed with it. Incorporating exercise into your daily living is a great way to improve your quality of life. If anyone is ever diagnosed with multiple sclerosis, I strongly encourage them to do so.